Hello, everyone. Thank you for joining me for another episode of the Plant Free MD podcast. I'm your host, Dr. Anthony Chaffee, and today I have a very special guest, a good friend of mine, Coach Stephen, all the way from the UK, sunny old England. How you doing, Stephen?
Yeah, well, you've hit the day when it's sunny today.
Yeah, yeah.
We've actually,
One day of the year.
yeah,
Yeah,
yeah, summer is here. It's
yeah.
good.
For
Yeah.
this afternoon,
It,
there was the was that Little Britain, that little sketch comedy show. They're talking about
mhm.
summer in Scotland is on September 14th between
Yes.
2:15 p.m. and 2:35 p.m. and things like that. It was this wonderful time this year. Get outside, look at it, like, oh, this is great, and then it just starts raining again. They go back inside.
Yeah.
Yeah, that's sort of how I felt when I was over there.
Yeah, it's true. If the sun comes out, we report it as a UFO.
That
So
was that too. Yeah. Well, that's
yeah.
good. So Stephen, for people that haven't come across you before, don't know you, can you tell us a bit about yourself and what you do?
Right, I'm 61 right now, and for many, many years, I was a high carb advocate and advanced personal trainer. And I really thought I knew it all. I did a bodybuilding show. I won a tennis tournament, semi-pro soccer player. So I was pretty fit, not being big-headed, just giving people some context. And I mean, we spoke just before we came on. I'd lost my parents very early in life. And the reason I mention that is because my mother died of colon cancer. I was only 23.
Mm.
And both my mum and my dad believed the food guidelines and followed the food guidelines. And sadly, my mother was a product of eating lots of fiber because as her colon got worse, they just prescribed more and more fiber. Things like Ensure as well, Complan, and all these high sugary drinks, and she just plummeted. She didn't have any particular affinity to any particular food group or group. She just followed the guidelines, and so I did. And I suppose it's one of the things I always go on about when people talk about genetics. No, you eat what your parents eat in the main when you're a kid growing up, which is why I've got not just English teeth, but really bad English teeth. I avoided red meat, saturated fat, and the point being, up until my 40s, I thought I was doing the right thing. And then I've got two honours degrees in my life. One is in English literature, and the other is physiology and health sciences. And I got to the stage where I was really lucky to train an athlete who had type 1 diabetes. And this is my mid 40s. And obviously, she wasn't. And we got her to the Olympics. But what that triggered in me was an interest in the fact that she knew type 1 diabetes better than anyone I'd ever met or been trained about. And she didn't follow any of the guidelines. She did what she thought was best for her, which was great. And it was nice that she employed me to train her. So I was about 45 at this point. And maybe I should have realized that everything I've been taught was rubbish, but I
Mhm.
didn't. And we were doing a lot of lab testing. And I got involved in that as well. And you know me, so you know where this is all converging, I would imagine. Anyway, I started to think, well, this is strange, but maybe it's a one-off because she's type 1 diabetic. That's very different to everything else. And I really got interested in helping people lose weight and try to manage diabetes full stop. So I started a clinic and I um, got qualified as a specialist practitioner, not a general practitioner in obesity and diabetes. And this is where it took a really funny turn. And I kick myself when I look back. But I used to take in groups of 10 people and we'd follow them over a few weeks. And then there would always be a new group. So there's always a cycle of new people. And the ones that invariably did well, when I asked them, what are you doing? They said, ignoring you, because they were basically doing what we would now call carnivore, but they called it Atkins, or they were
Mm.
doing keto, which at that point they just said we're cutting out carbohydrates. But it
Mhm.
took me 4 or 5 years to really wake up. And also we were doing blood tests. We were getting a nurse practitioner in, and I noticed that the results and what the doctor's comments were, who hadn't seen these people, didn't make any sense compared to the people. So we had these bloods coming in, a doctor's comments from sort of a remote area, and I talked to the person and say, well, they're really destroying you here, but you're one of my success stories. I don't get this. So I trained in phlebotomy as well. So come age 50, I realized that I got it all wrong. I've been lied to, and my own health had taken a really bad turn. I had a coronary artery calcium scan of 639. Didn't
Mm.
smoke, didn't drink, didn't have red meat, didn't have saturated fat. I did all the things. Here's a kicker. I had lower left quadrant pain, had a colonoscopy. I mean, you work in a clinical setting. I can remember sitting in the outpatients bit, genuinely thinking that's it, I'm going to die because my mum had colon cancer. It's all genetics. I've got a pain in the same area. Here I am, my heart shot to pieces. My lower left quadrant is giving me lots of pain. My blood told me I was, becoming diabetic. It was all going wrong at 50. And of course, it didn't. Here I am, 11 years later. And what changed it? Taking out the carbs, not listening to the food guidelines, and listening to the people around me and using my eyes and my ears and my brain and thinking, none of this makes any sense. And, when I did the diabetic training, I was really cross with the fact that none of the doctors, none of the physicians, none of the training staff wanted patients to have glucose monitors in their hands because they said, well, if they have that, they won't listen to us. They'll do what,
Mm.
is literally saying they'll do what's best for them, which is really stuck with me because this isn't a rant against the medical people. It's about the medical system.
Mm.
There are no nefarious people working in these places. They genuinely believe what they're told. So it's really top down. That's the problem. Right at the very top, the guidelines and big pharma, big food, and all that. But anyway, the point being, went low carb. That worked okay. Did keto up until about age 55, and then joined MeatRx with Sean Baker,
Mhm.
got into carnivore. I used to do his Thursday diabetes meeting, which was, hats off to Sean for having the faith with me to let me do that. So that was really good. Then went out on my own, did a bit of the steak and butter gang, hooked up with Richard Smith, do live question and answers on YouTube from State Control Britain every
Mhm.
Sunday at 7 p.m. And it got more and more qualified in every area, really. And I haven't been to the doctor for 10 years. I'm not on medications. I'm not diabetic. My lower left quadrant pain disappeared. My athlete's foot went all naturally. So basically, to quote you, just eating meat and fat and drinking water and doing all the things that are species appropriate literally changed my life.
That's great. And now you're, preaching the gospel, and bringing that on to other people, which is great too. So so what is your main focus on your work now? Are you working one-on-one with people, working in groups, or trying to just make content to try to get this out to as many people as possible?
Well, that's great question because it's a bit of everything. So
Hmm.
I do one-to-one consults online. Richard Smith, the Keto Pro, and myself, we run a school group, a school community. So that we do meetings 3 times a week. So that's sort of groups of like 40 people.
Hmm.
And then we do our live question and answers on a Sunday, which is about 2,000 people. But I also write a Substack, which is a daily article based on my experience, labs. I teach people how to interpret labs for themselves. Because going back to that thing about putting the glucose monitors in people's hands, I want to put the knowledge in people's heads.
Hmm.
So I don't, I try to demystify it all, break down terms, and that gets about 80,000 people reading every week.
Very
Sorry,
good.
every month. I'd
Yeah.
like it to be every
Nice.
week, but yes, every month. But I think that's it. I think you're the same. You're the same. You put out your audio podcast. You do, public events. I do that as well. And I think just get the message out to as many people as you can in different forms. So I'm on Spotify, YouTube, like I say, Substack, and
Yeah.
doing live Q&As and all that. So yes, getting it out every way you can,
Mm.
and actually meeting people face to face is really great. So when we do the meetups, that's really good.
Very good. And then, so obviously you've started applying this out to other people.
Mm,
And the reason that I do this is because I've just seen so many people benefit from it. I mean, my happy place is in the OR. If I could just operate all day, every day, and that's it, that's where I'd be.
mm,
But it's something that I've actually, put to the side for a while because this just helps too many people
mm,
from what I see. And so that's why I've sort of changed my practice to that and helping people online as well. But in your experience, what have you seen? Carnivore diet or even just low carb, therapeutic carbohydrate restriction, ketogenic diets. What have you seen this improve in people's health outcomes that, typically we're still thinking are irreversible sort of conditions?
Well, I suppose the most striking amount wise is reversal of type 2 diabetes. And maybe
Hmm.
that's because of my background. So I attract that sort of person in the first place. And that, that's the way it is. If you specialize in back pain, all you see is people with back pain. So that's your world, that's your bubble. So I think reversing type 2 diabetes is probably top amongst things. But some really strange things that seem to have become a bit of a niche, like returning kidney function.
Hmm.
But that isn't that odd when you know the joined up thinking, because if you can, most people with kidney function problems have a glucose intolerance problem, or they are already diagnosed as diabetic. So you literally say, if we fix your glucose intolerance, we're going to fix your kidney by sort of default. And this isn't just minimal stuff. I mean, I've literally had people that have come in, and one in particular was given 2 weeks to live. So the kidney
Wow.
function is really low. Yeah, absolutely. So we've reversed a lot of kidney function problems, got it, getting the filtration rate up, the numbers up. Part of that is down, to the misinterpretation of the EGFR,
Hmm.
which is an estimated glomerular filtration rate, which is based on dietary protein intake or creatinine or the waste of that particular way of eating. So getting people to have a cystatin C, which is not reliant on dietary protein,
Hmm.
to firstly get a really good baseline number, because you could magically say, I am going to fix you, do 2 weeks of this thing, get a cystatin C, and while lo and behold, you've improved the numbers by a lot.
Hmm.
I'm alluding to something else there. Messing with the numbers is not what I want to do. I want to
Hmm.
get people fitter and healthier. So once we get a baseline that's a bit more reliable, which is the cystatin C, then go from there. And but even that has pushback from the medical fraternity that wants to stick with EGFR, which is unreliable.
Hmm.
Luckily, and it's the only good thing to come out of wokeism, is in 2021, a big group said that the EGFR is racist.
Oh,
That's
yeah.
because it, because the calculation has a racist factor to it. So if you're from a certain ethnic background, they will take your number and multiply it up by 1.6. So
Hmm.
that's the only good thing to come out of wokeism. So I think that's quite interesting that they want the cystatin C as well, because it takes that out as well, which proves it's a much better number. So kidney function, probably it's the second one. And I would then be very wide and just say just general overall health. It, Many
Hmm.
people come and say, I didn't realize that the joint pain I had wasn't age, it was the way I was eating. So they might come for a particular reason. And we'll use diabetes as that reason. But then they will say maybe 6 weeks into this, wow, I didn't realize I can go down the stairs now without, my knees are hurting. Or their skin will clear up. Something will happen which they didn't even realize. So when we're in the school community, only last night, we had a guy saying, I've just realized that my ankle pain's gone.
Hmm.
But the absence of a pain is a really weird thing, because if you have a bad shoulder, it just bothers you. If you wake up one morning, it's gone, and you've got a busy day, you might just go through the day and not even realize. And
Hmm.
it's till someone says, "Is your shoulder still hurt?" And you go, "Oh, no, it isn't actually." So I think there's a lot of undiscovered illnesses out there people don't realize, and they're accepting, which is what I did when I was 50 and sat in that room. I thought, oh, it's all genetics, which it isn't, by the way. It's more epigenetics, much more epigenetics than we're led to believe. Um, so the way they start eating, and eating species appropriate diet, and to steal Ken Berry's thunder, the proper human
Hmm.
diet,
Hmm.
can cure things you didn't even know were wrong with you.
Yeah. Yeah, absolutely. And I've seen that with cystatin C. I've seen people with, end stage CKD. I mean, bordering
Mm.
on needing to go on dialysis, being able to actually reverse it on a dime. And a good friend of mine actually was down to like something like 19% kidney function. And he then switched, and his doctor said that, oh, you're going to kill yourself. That's going to destroy your kidneys. And he just said, look, everything you've been telling me, everything you've been giving me has just made my kidney function get worse and worse and worse until I'm bordering on needing to go on dialysis at 35. And so I'm just going to try this. And within 3 months, he had increased up to 80% kidney function. And his nephrologist kept saying, like, you got to stop, you got to stop. This is going to kill you. This is going to kill your kidneys. It's like, what lab tests are you looking at that I'm not seeing here? It's like there's stuff that you were doing was making him worse, and the stuff that he was doing obviously reversed that. But I've seen that too with cystatin C as well. I had a lady who came up to me at a conference, and she said that her husband was again in that area of almost needing to go on dialysis, and they were both physicians, and they gave this a try, and all of a sudden it turned the ship, and his creatinine, to your point, the creatinine didn't really change. But when they checked the cystatin C, that started improving and getting a lot better. And so his, estimated filtration rate via the cystatin C, that started improving and going up as well. And he's clinically doing a lot better as well. So
Mm.
that's definitely something I've seen before also. And, and at other times too, I've seen people's creatinine come straight down as well. So that, the traditional ways of studying the EGFR, I've seen that improve as well. But anybody who is sort of stagnant or a bit high, just remember that. I mean, even people that have a lot of muscle mass and things like that will tend to have higher cystatin C, or sorry, higher creatinine levels, and therefore lower EGFRs. But yeah, and you mentioned that about gaming the numbers and just trying to get an effect
Yeah.
based on a piece of paper. And as we were talking about before we came on, there's a saying in medicine, which is you treat patients, you don't treat lab tests. But sometimes this is all they go on. They just go on like, well, we need this number or this number range. And I mentioned my patients that had um, they needed to take a cholesterol test for like an insurance test or something like that. And so what they did was they understood the physiology, because we spoke about this, that when you go on a ketogenic diet, your LDL and HDL go up because LDL and HDL transport fat around your body, fat, cholesterol, and proteins from your adipose tissue to your liver. And so if you're running on fat, you're running on more fat, you're going to need more LDL and HDL to transport that fat. It's a pretty straightforward concept. And also, you're getting rid of these plant oils that have um, these plant sterols, the plant cholesterol that tell your body to make less cholesterol. So now you're artificially lowering your cholesterol even further. So they added in they just drank milk and had some coconut oil, and that was it. So it was still nearly full carnivore, but a bit of coconut oil, right? And sure enough, their cholesterol level came down into the so-called normal range. Their policy was happy, and then they just went back to doing whatever they wanted to do, which is interesting. So, but that's gaming a system. I don't think that that's the right thing to do. I don't think that's what people should do, certainly not long term, because I actually believe that cholesterol is good for you and your body's doing this on purpose. And if you just don't eat for 5 days, that's what your body's going to do. It's going to raise your HDL and LDL and lower your triglycerides. And so I think that just gaming things just for an effect of a number may actually be detrimental. But what are your thoughts on that?
Yeah, well, have you got 3 hours? I think
Yeah.
this all started actually for me. Well, firstly doing the bloods, as I say, and that was like 15 years ago, where I realized that the numbers didn't seem to work. When you certainly when the doctor was remote, it didn't match up. But it got very stark about 6 years ago. Like I say, when I did the diabetes meeting for Sean, there was a lot of members who were really into the numbers, into the data, and they started to question a few things, and the HbA1c, hemoglobin A1c reading, which is okay for people on the standard Western diet. If you're vegetarian, for many people, it's okay. It's not reliable though. It's not a very reliable number. But the point being that I had a lot of people coming on board, and they'd say my CGM, which I'm wearing all the time, tells me on my average is, let's just say, for the number's sake, it's 100. Let's just say 100. And then when I do my capillary testing, that sort of backs it up. But Stephen, I've just had my HbA1c and it's 120, so
Mm.
it doesn't make any sense. Well, firstly, I'm a real common sense guy. So are you. Yeah, I mean,
Mm.
if someone looks pretty healthy, they probably are, and if we do a few tests on them and those numbers look okay, but I'm still going to go with the clinical presentation. Anyway, that happened more than once. This was so common. People saying, I don't get this, and then I've gone and had a full set of labs and I've had my fasted insulin, fasted glucose measured. I'm doing really well. I'm doing this. That's the best management of my blood glucose ever. My HbA1c is creeping up. So what's happening? Well, then I went back to my training and I can remember being told about artificially low HbA1c. And if someone has a low HbA1c, but you're looking at them and they're saying, oh, I'm really thirsty and I'm urinating a lot and I can't quench my thirst. And pretty much they look diabetic, puffy face, bloated stomach is one of those things, sadly. You've got to look at that HbA1c and scratch your head and say, well, maybe something else is going on. Maybe the red blood cells are dying too soon. And that's basically what hemolytic anemia is, where your red blood cells don't last. Because it's a calculation. It's not a direct measurement. HbA1c, it looks at the glycation, doesn't definitely do that, but then it factors in a number. So they assume your red blood cells live 120 days. So again, the reason I'm using the same number is just to make life easy for people. If, let's say your score was 120 for your glycation rate, and you said, yeah, well, we've got to factor that by 120 days. So it's 1 unit per day. But your red blood cells live 60 days in reality, right? You're going to get a completely different number. Your glycation is going to look, a lot worse or a lot better, depending if they're living longer or shorter. And we know this is true because you do what's called a reticulocyte count. And I think you get involved in bone cancer sometimes. I'm not sure. And, the way you diagnose bone cancer is you look at the reticulocyte and the red blood cell count. And if it's, if the reticulocyte number is going through the roof, your body is trying to produce red blood cells in huge amounts. But if you've got a low red blood cell count, they're being killed. It's not happening. Something's wrong. So you're either very anemic or even to the point where you possibly got cancer of the bone marrow. So it's a big deal. And it's not even medically controversial. So what would happen if your red blood cells live longer? Well, you're going to get an artificially high HbA1c, and lo and behold, that's what happens. So we're doing the bloods, and I now sort of try to get a reticulocyte count done. So going back to your game in the number, I can say to people, right, if you want it to be lower, then you've got to go back to eating carbs. But you're not actually curing the problem. What you're doing is you're making red blood cells not live as long.
Mm-hmm.
And you can do that, but it's a ridiculous thing. Luckily, there are labs now looking at what's called HbA1c, adjusted HbA1c. So this isn't me just making this theory up. This is in clinical practice. This is what biomedical researchers are looking at, where they factor in the life of the red blood cell. Because there are so many people with these devices in their hands, on their arms, finger pricking and all that, and even Apple Watches or whatever, who are saying, this makes no sense. This number does not match what my average daily blood glucose is. The common sense of it is, if you look at your blood every single day for 120 days and then you work out your average and it doesn't match the lab value is wrong. Okay, so now we get people saying that, the HbA1c has gone up, we've got to do something. And it must be because there's not enough insulin, there's too much blood glucose floating around. No, it's a number that you're misinterpreting. I mean, sorry to do the old, you smack your head, but have a look at what's going on. So, I'm finding that very frustrating. If you just take a broad step back, a lot of the numbers are wrong because these reference ranges aren't optimal ranges in the first place. They're just averages. And as the population gets sicker, they shift these averages. So it's not set in stone. It's not based on athletic performance. It's not what a perfect human should be. It's what an average person could be. And if you go to a shopping mall, I don't want to be the average person because I don't think they're particularly healthy. And then you've got to understand the physiology. So the bane of my life is things like, people saying you're tanking your T3, which maybe we can come back to. That's not true on this way of eating. It's just appropriate and lower. Or you're worried about your insulin being, too low. Well, the case. It's appropriate. I mean, look at you. You've got muscle. I've got muscle. Many of my carnivore colleagues,
Mm,
looking pretty healthy. If you didn't have enough insulin, you wouldn't have enough muscle. Just you would
true.
waste away. Simple as that. So we know it's an appropriate level. And where are they getting this low number from? Well, they're getting it from reference ranges. If the range is 2 to 20, what's that based? Well, that's based on somebody eating 45 to 65% carbohydrates. Yeah, that's a great range for those people. But it's not for people eating 0% carbohydrate or 5%, because you need less insulin. To me, it's not even rocket science. It's just common sense that if you look at these numbers and you think, well, we've got to game those numbers, which is what people are trying to do, you're looking at it completely wrong. And of course, we know about glucose. If you add carbs, it isn't even inoffensive. It's a bad thing to do. Just going back to red blood cell production, use that as an example. There's a 9-step process to make heme, for instance, and there's an enzyme called ALA at the first stage. And what limits that? Glucose. If you have higher glucose levels in your blood, then your red blood cell production, which includes incorporated hemoglobin, obviously, that's going to be kicked into touch a little bit. And we can see that with the MCV, what's called the mean corpuscular value, which is how big your red blood cells are. So when you're eating carbs, that tends to go down because the heme production is reduced. It's still viable, but it's not optimal. So when you see those numbers going up, I get people going, oh, my MCV's gone up. My doctor says that's bad. I've got big red blood cells. No, that's carrying a lot more heme because it's able to do that. And also you're not restricting heme production at the early stage because your glucose levels are actually appropriate rather than, inappropriate. So when someone says just have a few more carbs, what you're actually saying to that person is, let's increase some glycation. Let's make all your proteins deranged. It has such a knock-on effect. It's incredible. Yeah, it will raise your insulin because your insulin is saying, this is toxic, guy. You need to get rid of some of this glucose. But you're not actually making anyone healthier by doing that. So if you look at the red blood cell, use that as an example, because that's what we're using as a proxy marker. Because don't forget, when you glycate proteins, you're not just doing it to the hemoglobin, you're doing it to things like albumin. You're doing it to a thing that is transporting so many nutrients around your body. It's absolutely critical. You're glycating, collagen. So that's why people look older when they have a lot of carbohydrates, because you're deranging all the proteins there, all these cross-linkings going on, and you look older. So there's loads of things. But if you just, sorry, I've gone off the subject, but if
That's
you
fine.
just focus on the red blood cell, you're making 2.5 million every single second, red blood cells. You're recycling 2.5 million every single second. In that red blood cell, there's 280 million proteins that are called hemoglobin, just in one red blood cell. So you're going to glycate some of that. So once that has happened, and because once you glycate, which isn't being sticky, it's a chemical, it's a bond at an atomic level. It's an irreversible bond as well. Once it's done, it's done. So it's in there, it's deranging that protein, making that protein not viable. And you're doing that to your hemoglobin. You're also doing it to the structure of a red blood cell. And we know glycation isn't a problem for the red blood cell as much as deformability. So when you start to make these cross-links, your red blood cells go into the spleen, go into the sinusoid, and they can't deform. Now, normally when you say there's a deformity, you think, well, that's bad, but not with red blood cells. It needs to be able to squeeze into spaces, move around, be very, very flexible. Once you start glycating, it can't do that. But more importantly, the membrane, which has membrane proteins and lipids, it starts to lose its deformity, which is where you're gaming the number. Because basically you're saying, here's the red blood cell, we're going to glycate it with a little bit more glucose, and we're also going to call a bit of lipid peroxidation, and we're also going to make that not pass the test. So, simply put, in the spleen, in the sinusoid, there's a Disney type sort of entrance fee. If you're over this size, you can't ride. All right. So that's what happens, and it gets kicked out. So it's not viable. Well, when you keep the glycation and low, you can see that your red blood cells will last longer. But the level of daily glycation is less. But because we go back to that stupid calculation where we're assuming it lives for 120 days, it artificially raises the number because, you've got glycation from 150 days, but they're assuming it was over 120. So it's a higher number. It's really that simple.
Yeah.
So we've got to get into that. And, it's just crazy because it's affecting all the other proteins, which is remarkable. So you're causing all this damage to gain a number. You're not actually improving the body's system one bit.
Mm-hmm.
So I
Yeah.
saw you taking notes. Sorry, I'll take a
No, you're
breath.
fine.
But
No, you're fine. No, I was just going to say too. I mean, the plant sterols. I mean, people point this out that the plant sterols are close enough to our cholesterol that they can get used, especially in like membranes, and so they go
Mhm,
into the membranes of red blood cells, but they're not as functional as our cholesterol, so
mhm,
they make much more stiff and rigid cell membranes, so they're not as flexible and foldable and malleable,
mhm,
and so they get taken up by the spleen more readily. And so it's been shown previously that people that eat a lot of vegetable oils, seed oils, things like that, plant fats, just generally, it doesn't even have to be seed oils, it can be avocado, whatever,
mhm,
that they have an abundance of these plant sterols in their body, and they can actually have a shorter lifespan to their red blood cells. So it's sort of the opposite. And so you take out those plant fats and you're not glycating everything. I mean, there's no wonder that these things live longer and therefore have more time to expose their hemoglobin to the even lower levels of blood sugar that are there, and then have an artificially elevated HbA1c. I mean, we need to have reference ranges for ketogenic group and
mhm.
even full carnivore groups, but at least ketogenic. I mean, that's a major metabolic change. And so we're going to get major differences in the blood levels, even the averages. And that's not even to say optimal averages, where we even have these for just people who eat whatever. Done studies in Germany where they take people in their 20s, normal BMI, and no diagnosed medical issues, which is it's a pretty low bar to get over,
Mm.
right? But when you look at these nominally healthy people that just don't have anything diagnosed and are of normal BMI. I mean, I wouldn't even qualify. I'm technically obese. I'm right at BMI.
Yeah.
I balance between 29.5 and 30 BMI,
Mm.
depending on how much I'm in the gym, but that's, but if I'm obese, it's because I'm more muscular and I've been working out more. And so they look at these people, just normal BMI, just no diagnosed medical issues, and you get very different reference ranges. And so we would get very different reference ranges if we just took an average sampling of ketogenic or carnivore populations. Well, what if you took that optimal, just sort of, between 20 and 30 or 20 and 40, and normal BMI? It might even exclude a lot of people that are muscular, whatever, but just
Mm.
no diagnosed medical issues either.
Mm.
You get it even different um, level still, and that's important because doctors are basing entire treatment protocols on these numbers, and these numbers are essentially meaningless in a lot of cases.
Well, absolutely. And the thing is, I think this adding carbs back in
Mm,
theory, yes, it will gain the number, but it
hmm.
is destructive. It is destructive. And
Yeah.
even if you want to get into lipids, you get into the fact that ApoB, which is attached to LDL molecules, that will be glycated.
Hmm.
LP little a, which has the Kringles, that there's still amino acids, they've still got nitrogen bases, so they will still be glycated, permanently damaged. Then you get into, the glycated LDL particles, which people I think sort of know is not a good thing. So you're actually going to increase all of those things. So it's not a simple equation. It's not just like one number we're going to focus on. The other thing is, I mean, your blood glucose, you're constantly being told you've got to worry about insulin, which definitely is a factor. But don't forget, there are 14 glucose transporters, and not one of them is totally insulin dependent. In fact, 13 don't need insulin at all. And even the major one, which people talk about, GLUT4, has 5 different mechanisms to translocate and start to work. And only one of those is insulin. The rest is about movement and calcium balance and energy substrate, and it's mechanical. If you lift a weight, you are going to improve your GLUT4 expression. Simple as that. That's why people on, when I used to do the type 2 diabetic system where we were trying to help them even on high carb before my eyes were opened, if they did exercise, they did get slightly better. There's a mechanistic reason for that. And, I think this obsession with constantly trying to, manipulate the HbA1c and also improve your insulin, make sure your insulin isn't low, it's not suppressed or whatever. Well, that's just looking at a tiny part of the whole thing. And your glucose management is more than that. I mean, the passive diffusion of glucose into cells is not accelerated by insulin. So if you've got a low insulin state, you're going to have slightly more blood glucose floating around. Also, if you're eating more fats, as you just said, every cell is going to be full of fats for energy. So glucose isn't going to go in. I mean, I'm not a big fan of the term insulin resistance. I think it's physiological protection of the cell. You don't want an overplus of energy. So if it's got enough energy substrate in it, that's in the form of fat, why would it let glucose in? It doesn't need to do that. It's protecting itself. So I don't think that's insulin resistance. I think that's physiological adaptation to a high fat diet. Again, that just makes total sense to me that you would have a cell looking after itself. So I don't think raising insulin, it's a bit like, it's another way of looking at something like metformin, which is really forcing glucose into cells where it shouldn't be. I'm not a fan of metformin, you can probably tell, and it works on the AMPK, the enzyme there that will basically say, although we have enough energy in the cell, we're going to force even more glucose in. So yeah, again, you gain the number with metformin. You've taken it out of your circulation, but you put it into a cell that doesn't want it. So I'm not a fan of that at all. I'm not. I just want people to realize that we've got to start doing some joined up thinking, not look at one number or two numbers, but actually think of the mechanism behind it. I mean, that's the great thing about the hematology side of, phlebotomy, is you can reverse engineer what people are saying when you look at, well, why? Because that's what I do. I know I did a decade of private blood testing where it's no good to say to someone, that's high, that's low, so that's okay, because that's gone up. I want to be able to explain to people it's because this has happened that's changed, not the other way around. You have got low triglycerides because you're not eating carbohydrates, so your body isn't changing the carbohydrates to fats or whatever and making more triglycerides that way, or whatever the thing is that you want to say to someone in a very simplistic way. But I think that's the thing. So when someone says to me, use T3 maybe as an example, my T3 is tanked, right? And well, how are you feeling? Well, I feel great. And this happens, honestly, this happens in our school community so much. And last night I was asking questions. Have you got this? Have you got that? Unexplained weight gain, weight loss, cold, hot temperature. They were worried about their thyroid, and they were just answering in the chat because they didn't want to do it on the video. No. It's quite funny, really. If we'd videoed it, we went through every symptom of a thyroid problem. They had none. And at the end, they said they feel really great, but the number was bad. Someone had said their T3 is too low. Well, it isn't too low. I mean, you need a certain amount of T3 when you have a lot of carbohydrates, simply put, because T3 works in glycolysis. It moves the pyruvate across the mitochondrial membrane. You need a lot of T3 to do that. Well, if you're not relying on glycolysis, you don't need so much T3. So using your example there, the reference range is wrong because it's not appropriate. I'm going to be cheeky here. I mean, that's why I wrote that book, Guide to Blood Tests, in the context of this way of eating. It's because there's so many of these anomalies where the reference range is so irrelevant, but it scares people. And, the lab will put a big red flag on it. The physician, you must come in and talk about your thyroid. And you've got no symptoms, but you've got a really low, low is the wrong word. You've got an appropriate T3, but according to the range, it's low.
Oh, sorry, go on.
No, you carry on.
Well, no, I was just going to say, and the thing is that I do hear that detraction that, you go on a ketogenic diet is going to tank your thyroid. And of course, there, as you've mentioned, this can be very appropriate. Professor Finney has actually shown this in several of his papers, that in a ketogenic state, you simply don't need as much thyroid hormone to affect the
Mm,
same physiological benefits and metabolic stimulation. So there's that. But the other side of it is I actually treat a lot of people that have thyroid dysfunction and they have low T3 and they have high TSH and all these other sorts of things. And some of them are outside of the reference range and some of them are just outside of the optimal reference range so that their doctor says your thyroid's fine, but they're symptomatic. And they have all these symptoms, these signs and symptoms that they're low thyroid. And so I look at that under an optimal sort of reference range for the general public. It's not even optimal for anybody else, but when they first come into me, they are the general public, and they're outside of that optimal range. Okay, so we talk about that. But when I put them on, especially a carnivore diet, so a plant-free ketogenic diet, I almost always see their thyroid improve and their T3 as well as TSH and T4. And there's a lot of reasons for that. Number one cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune condition that carnivore diet seems to help quite a lot and lower those antibodies down, lowers the damage, and your body can start reversing this damage and start improving function. Um, getting rid of plants. Plants, there's an entire category of plant toxins called goitrogens. People can just Google that. Go on ChatGPT and say, tell me all the different plants with high levels of goitrogens. They will be all the ones that are in the produce aisle, a lot of leafy greens and things like kale and broccoli and so on. And these block iodine from entering the thyroid and being utilized to make thyroid hormones. So you may need an abundance of iodine. Maybe you don't have that. Um, and then you can maybe have low iodine. But at the end of the day, when I get people on there, I almost always see their levels improve dramatically. And I see sometimes their levels change when they start adding things back in and their TSH starts climbing up and people don't even realize that all the anti-nutrient effect of plants for medications as well as nutrients. So I have patients with on thyroid medication. I had a lady the other day, TSH in a general range would be between, zero point 0.4 and 4 or 5. It's pretty average. But optimally, it's between zero point 0.3 and 1.5. Above 2 can actually double your risk of developing thyroid cancer. So that's clearly not an acceptable range. Again, that's this normal range. It's not necessarily an optimal range. Thyroid cancer is very rare, so double a small number is still a small number, but it's still expressing
mm,
the fact that there's some physiological stress that's being put on your undue stress putting on your thyroid. And her TSH, and she was on actually quite a high dose of thyroid medication. She's been on it for years. And she's hasn't really been able to stick with a carnivore diet. We're sort of working on that. And her TSH on this medication, same dose she's had for years, was 56, right?
wow,
So
wow.
any range you look at, that's bad,
Yes,
right?
yeah.
That means that the body's really, really, really trying to work expressly hard to get something done, anything done. And her T4 and T3 were actually quite low, and she was quite symptomatic. Turns out she was having coffee with her thyroid medication. Coffee
Mhm.
is replete with these anti-nutrients, and so I've found in my thyroid patients that you have to delay about 2 hours. Just through trial and error, we found that out that was sort of the sweet spot. That wait 2 hours after you've had your thyroid medication before you have coffee, and half an hour before you have anything besides water. And I talked to her and I said, hey, were you able to do that and delay? And she's like, well, yeah, sometimes, sometimes an hour, sometimes two. It's like she wasn't even as rigid about it. Just changing that, just the timing of her coffee.
Yep.
Her TSH went from 56 down to 6. So and her T4 and T3 both came up. And so still not where I wanted it to be, but massive, massive difference and
Mm,
improvement in that as well. But yeah, I just wanted to sort of mention that I actually see a lot of people improving. I mean, my every time I tested my thyroid over the last sort of 7 years, I think maybe 3 or 4 times I've tested it. It's always been in that optimal range for
mm.
the general population. These studies have done out of Germany looking at sort of the optimal 25-year-old hormonal pattern with normal BMI and no diagnosed medical issues. That's mine's been consistently that. I don't see too often people actually have low levels of T3. I know I've heard of it, but I haven't really seen it too often. And then I've seen other times, um, people massively improving their testosterone, doubling, even tripling their testosterone sometimes. And then you get a
Yep.
one-off every now and then. They said, "Oh, my testosterone didn't really do anything, but I feel so much better. I'm losing weight and I'm putting on muscle, and it's really easy to I'm able to go harder at the gym, and it's easier for me to put on muscle." And it's like, well, then who cares? Like, I mean, that's
Yeah,
what you want. I mean,
exactly.
we're not going for the high testosterone award, as far as I know, that's not a thing. You're trying to be healthy, and you're trying to, as an athlete, perform in your sport. But at the same time, the majority of people I see do increase their testosterone dramatically and get the physiological benefits. And then sometimes you get the physiological benefits, but you don't see that massive doubling or tripling in your numbers. And famously, Sean Baker tested his numbers. It
Yes.
was the day after he did a heavy workout, which actually can lower your levels. So if he
Mm.
tested again, who knows? But I mean, the guy's yoked. He's an
Yeah.
absolute moose. And like I've worked out with him. That guy is a beast. He is
Mm.
really strong, and he has a lot of like, endurance and strength endurance. The guy just keeps going. And the idea that dude is like physiologically low testosterone, like is just a joke. I mean, like whatever that guy has, that's exactly what he needs because he's killing it. And something he pointed out was that your testosterone receptors increase when you have more dietary carnitine. And
Mm.
carnitine is very, very abundant in red meat. And so he's obviously going to have a lot more testosterone receptors. And you can have the same level of testosterone, double the receptors, you're going to get a near doubling of effect as well.
Absolutely. I mean, what is in the blood is not what's in the tissue.
Yeah.
That's true of all the readings. I mean, just quickly, I want to go back to T3 for 1 second because there is one of the other things people talk
Hmm.
about is that gluconeogenesis is stressful, which is
Mm.
firstly ridiculous in
Yeah.
its entirety because we do it when we're asleep. Everybody does it, whatever way they're eating. Gluconeogenesis is just a physiological process. But they were particularly worried because firstly, I've been told I'm stressing my body out because of gluconeogenesis and my T3 is low. So I've got to increase my T3. And I just pointed out, you do realize that one of the things T3 does is it stimulates gluconeogenesis, which
Hmm.
is, the ridiculous thing. And this was actually an influencer who had booked me privately. And I said, yeah, I've seen some of your stuff and you need to stop saying that because T3, two of the primary things it does is glycogenolysis. It will take your glycogen, strip it down and make glucose, and it will do gluconeogenesis. Well, I didn't know that. I said, well, you shouldn't be talking about T3 the way you do if you don't know what it does. So what you're actually saying, when I'm watching you is, you need to not be doing gluconeogenesis because it's stressful. So therefore have some carbs and also that will put your T3 up. And then you're actually making your body produce more glucose via gluconeogenesis as well. So I think the joined up thinking, what you just said about, the infamous pencil neck, Sean Baker, and his
Yeah.
low testosterone, you've only got to look at the guy, like you just say, and say, the testosterone values don't really matter because it's worked for him. But you added the mechanism as well. So for people that want the common sense with the mechanism is always there to explain all these things. If something's allegedly low or high, problematic, this is a compound we shouldn't be making in our body, whatever. The body's really smart, and you've got to look at the outcomes. The old thing when computers came in, there was a thing, wasn't there, where it was garbage in, garbage out. If these
Mm.
computers aren't great, they're not magic. If you put the wrong information in, you will get the wrong information out. Well, the body's the same, right? So you can't look at Sean and say he's doing the wrong thing. You
No.
just can't.
Yeah. You can't.
So,
No.
but I can certainly go into a shopping mall and go, I think that person over there is probably doing the wrong thing. And I think that one there is right. I I know it's bad to judge a book by its cover, but that's the best thing we got, isn't it?
Mm.
So that's a common sense start.
Yeah.
And then when you add the mechanism, you're golden, I think.
Well, and we do spot diagnoses all the time in medicine. I mean, there's this
Mm,
thing is like, okay, here's a picture. What's the diagnosis? I mean, that is
mm,
actually how we are trained. And there are
mm,
certain things that you can see from someone's appearance, and you can actually get quite a lot of information. And we are taught during the physical exam, when you walk in the room, you see what's going on there. Are there anything around the bed? Is there like a bunch
mm,
of snacks and cupcakes, a pack of cigarettes? Is there, a bag of IVs hanging there? Is there what does the patient look like? All these different sorts of things. You can actually gain a lot of information there. And so yeah, it's just looking at Sean Baker and just being like, that guy's yoked and absolutely killing it for any athlete, but certainly at his age, that obviously there's no issues there. Like he's very healthy and he's a lot healthier than he was, and that's the important thing. That's what he talks about. That even when he was still competing at a high level athletically, he was well overweight, he had a lot of excess body fat, and he did not feel good. He felt very
mm,
unwell, and now he doesn't. So that's very important too. I have seen recently, and I'll get you to comment on this too. I'll give a bit of thoughts and then see what you have to say too. But I've seen a couple influencers online saying that it potentially wouldn't be a good idea to do like a ketogenic diet specifically for those sorts of reasons that you talk about. Well, maybe it can elevate if you already have high cortisol. Well, maybe it can elevate your cortisol more, and so this might not be a good idea. Or you're already suffering with hypothyroidism, so this can also suppress your thyroid even more. There's so much complexity, especially to hormones and different physiological systems in our body. I mean, we're talking about a system with tens of trillions of cells and trillions of interactions, chemical interactions, within each of those cells every second. There's no chance that you are going to look at one mechanism and go like, this explains everything. You have to know all the knock-on effects, and no one will ever know all the knock-on effects. You learn as much as you can and learn how these things fit together. But there's always the question of and then what? And then what? Okay, so if you do X and if you do X, then you'll get this result. Okay, and then what? And then what happens after that? And after that? And after that? And after that? And you're like, ooh, come around full circles. Like, well, actually, we don't want to do uh, something, whatever X. I mean, there are plenty of studies. Richard Smith and I did a whole like 2.5 hour
mm,
podcast on this whole idea, the whole Ray Peat idea that keto poisoning or whatever the hell, you can be in ketosis for too long, and this causes physiological harm. And that's something that a lot of people have bought into. We went through 2.5 hours going through all these arguments and showing direct evidence in the literature of better studies, higher quality studies with more people over a longer period of time, and experimental data sets showing the exact opposite of what these claims are making, like a 2-year study following people on ketogenic diets that did not elevate their cortisol, certainly not to Cushingoid sort of levels, but they were just normal. And their thyroid did not actually decrease. It actually stayed optimal, and a lot of other things improved. And like you said, um, there could be reasons why these things are changing. One reason for cortisol going up in some populations is that when you have metabolic syndromes, you're metabolically sick, maybe pre-diabetic or diabetic, cortisol actually gets suppressed, and you need cortisol. You need the appropriate amounts of cortisol. And then correcting that metabolic syndrome and pre-diabetes can actually normalize your cortisol. Oh, you see it go up. Up is bad. No, up to a great degree and a great extent is bad. But if it's just renormalizing, well, then that's normal. And then the other thing is that we actually use in Western medicine right now ketogenic diets to treat Cushing's, which is very high
mm,
cortisol levels, tumor that makes your body secrete excessive amounts of cortisol, or Cushingoid syndromes, where you have excessive high cortisol for other reasons. But it is in the literature that you can treat people with ketogenic diets, giving them ketogenic diets for Cushing's, or hypercortisolemia, because it actually being in ketosis actually ameliorates the negative effects of high cortisol in the body. So this is something that we actually put people on straight away, and then do some definitive treatment like pituitary surgery or something like that if this is actually Cushing's. And then of course T3 being low, well, why would you not go on keto just because your T3 is low or your hypothyroid? It could be something that you're doing, like maybe you have Hashimoto's, or maybe you are eating a bunch of goitrogens, and that's what's actually causing you to be hypothyroid. And going keto or carnivore is exactly what you want to do to improve your thyroid function. But what are your thoughts on that idea that you shouldn't do keto if you're sort of in those categories or other categories? Or are there categories that you would consider this keto carnivore is not for you? Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys.
Well, I was taking notes, Anthony, because there's ever such a lot there to unpack. I mean, firstly, cortisol is essential for protein metabolism. All right, so we need it, and I think these people are very much unable to listen to themselves because they're also the people that complain about adrenal insufficiency as well. So there's not enough cortisol, or there's too much cortisol. Of course, the problem is chronically elevated levels of cortisol, and what do we call chronically elevated? Because we go back to those reference ranges. And I'll use this as a simple thing to say, because if you go to the dentist, if you look closely, you will see a glucagon injection, okay, to raise blood glucose, not cortisol. And there's a really good reason for that. And the reason is cortisol isn't the main driver of glucose production. Glucagon is. And I think everybody knows that. All right. So firstly, they're looking in the wrong place. Secondly, there's medically proven mechanisms. Like I say, the dentist is the easiest one because they make it really available because they need it. All right. So you would think that if you want to raise blood glucose quickly, it would be cortisol. So there's a common sense thing. Secondly, like I say, it's involved in protein metabolism. We eat more protein, so we're going to need more cortisol. All right. That's another thing. And T3 will push glucose production up as well. So what do you want? Do you want to stop the cortisol because it's making gluconeogenesis happen, but in the same time add a different hormone that promotes gluconeogenesis by raising? It's not joined up thinking. That's the main thing.
Yeah.
And I will prove where cortisol, the production of glucose from cortisol, is different. Cortisol has a great effect that nobody really talks about. Okay, so they do talk about fight, flight, or freeze. If a tiger runs in here, I know it's corny, I'm going to want to raise my blood glucose, right? I wouldn't do it with anything other than cortisol, because cortisol is going to stop anything lowering my blood glucose. And you get what's called physiological insulin resistance. The body's really smart, because if you think about it, the tiger comes in, I need my blood glucose to go up. Yeah, I'm going to produce some cortisol, but at the same time, my body's going to lower my blood glucose. That doesn't make physiological sense. So that's where the chronically elevated issue is. And we're not doing that. We're not in fight or flight, because what's happening is our blood glucose isn't staying elevated. We all have very low blood glucose. So it's not the same mechanism, if you get my drift, because otherwise, if it was cortisol driven, it would always be elevated, because the point of a cortisol reacted glucose level is to stay elevated so you can run away and get up a tree or fight. And this is where the anxiety thing comes in as well. If it's chronically elevated, if you're in a job, you hate your life and stuff like that, anxiety is problematic. I'm not saying that isn't, but when you're looking at a cortisol reaction, it's absolutely essential, because the tiger coming in, you need anxiety to make a decision. We don't have anxiety for no reason. It's a physiological thing that we need. Without anxiety, I'd just go, whoa, there's a tiger. I think I might need to do something. My anxiety kicks in. It's like, right, decision time. I've got to go. And this is where, if we go back to common sense, this is why people in, say, a job where their manager they absolutely hate, why their health is destroyed, because they can't run away. They can't punch the manager in the face. They can't say what they really think. So they have that chronically elevated fight, flight, freeze response and a chronically elevated level of anxiety. That's nothing to do with diet. That's situational. That's environmental. If you want to get into the biophysics or, the biochemistry of it, two different things slightly, it doesn't make any sense that the body would produce cortisol when we need some slightly more blood glucose just to get through a workout, So when you go, like I say, when you work out, as soon as you contract a muscle, what's actually happening more than anything is the GLUT4 expression improves. So the glucose that you do have is uptaken, so you can feel stronger. And then you will get the response from the cellular level. And this is where the sodium potassium pumps come in and where the T3 mechanism comes in. So what's happening at the cellular level is your sodium potassium pumps go, like gangbusters, as they say, and that's detected. That's a T3 reaction. That's T3 that's doing that. And it will sense, wow, the metabolic rate isn't where it should be. The feedback will say, we need more. So what will happen is T3 production will go up. It will enter the cell and do exactly the same thing, go through the transcription factors, make the membrane proteins and produce more sodium potassium pumps. And that just gets the whole system going. That's not cortisol driven at all. And it's just crazy, because that's why you come out of the gym feeling good. No one ever says to me, I tell you, when I was an advanced personal trainer, I had many people say they don't fancy working out today until they'd worked out. And I never, ever in all those years had one person ever say to me, I really regret doing that, ever. So if it is cortisol, firstly, that proves it's not all bad. But secondly, it isn't cortisol anyway. You get all these good effects. You get endogenous morphine, which people call endorphins. So this is what frustrates me so much. You can probably tell from my body language that it's not understanding what's going on. It's making this, cortisol is a stress hormone and, it's really bad. And it's producing lots of glucose. No, it's not. It is in certain situations. That's when it's needed. If you can react when it's needed, that's good. But when you've got the environmental stress is the key here. So if you're in a job that's really bad, I tell you what, any way of eating is not going to make much difference. I think carnivore will make you more level-headed. I think you'll be less inflamed and maybe you'll be able to cope with it a bit better. But in the end, in life, you must get this sense. There are certain things where diet isn't the thing. We were talking about personal grief. If you've got some grief in your life, having a ribeye might be marginally better than having, fruit salad, but you've still got the grief. So you've got to deal with the actual thing that's causing the stress in the first place, or, the way you think about it. But looking at it as a sort of, like I say, biochemistry thing, cortisol is not the enemy, and we need cortisol. Cortisol is there for a reason. It wakes us all up. I mean, it has that effect. Again, there's a great example. If cortisol was bad, it would raise your blood glucose, but then it's got to do its job. It's got to keep it elevated. So it makes you, and I hate the phrase, but let's use it. It makes you insulin resistant temporarily. Because otherwise it wouldn't do its job. So cortisol is there to put your blood glucose up, to wake you up. So we have it every single day. Now, when we do a diurnal testing and we see that beautiful shape, like a sort of ski ramp, that's fine. You don't go, whoa, look, it's really bad in the morning. We all say, oh, we know what that is. That's to get you up. So cortisol isn't the enemy. But if we didn't see that beautiful shape, if we saw it across the day, it wouldn't be being in ketosis that's caused that. Absolutely not. It's not the stress of gluconeogenesis that's causing that. Absolutely not. There's something else going on in your life. Absolutely.
Yeah. Well, and also that's the confusion there as well is first of all, A, being in ketosis does not elevate your cortisol past physiological levels. A.
Hmm. Yeah.
B, it can ameliorate superphysiological levels of cortisol. And C, stress can increase cortisol levels, but increased cortisol levels for other reasons does not cause stress. And that's a
Mm.
problem that people look at cortisol
Yes.
and stress as synonymous. And they're
Mm.
saying that, well, if you have elevated cortisol, that's mean putting more stress on your system. And if you go into ketosis, that elevates cortisol, and that's putting stress on your system. No, like even if this were a physiological mechanism to say, oh, well, we wanted to raise your blood sugar, it's not that, oh, we're going to cause stress and then cause cortisol to go. That's actually adrenaline. Adrenaline
Mm.
is secreted when you are stressed or in that fight or flight sort of mode, and then cortisol actually ameliorates the effects of adrenaline.
Mm.
So I've heard people argue that it's actually adrenaline that's actually a very serious issue with stress, and then cortisol is actually the saving grace is coming in and putting out the fire caused by adrenaline as well. But either way you look at it, if cortisol is going up for a physiological reason, it's not causing stress. When you wake up in the morning, your cortisol level's up. It's not because you're stressed. It's not because
Mm.
there's stress there, and it's not causing stress. That's a normal physiological response, and that's something that people sort of get backwards all the time.
Yeah, that's what I was trying to say, but I think you were more eloquent than me.
No. I was going to say too, you mentioned insulin suppression. So this is something that's gone around. I've heard people talk about this before, and I've certainly had my views on this, and certainly never seen anything like this in practice, and so on. But I mean, a lot of times people bandy around these terms, and there's actually no real working definition. To say, oh, you should eat plants because of hormesis. The hell do you mean by hormesis? And there's tens of thousands of chemicals, there's hundreds of thousands, nearly a million. Which ones are hormetic and at what levels, and are they, and there's 1,000 in each vegetable, and so which ones are you talking about, which ones are hormetic and which ones aren't, and at what dose and how many leaves, and like what the hell are you talking about? Sort of a meaningless sort of term. And so insulin suppression, is there a working definition of this, and then what do they mean by that, and what would that really mean? Because to me that would mean that if you were, and then if you could go ketogenic or something like that, this could suppress your insulin, and you're not getting enough carbohydrates to boost this, even though that wouldn't really make sense evolutionarily, because there were periods of time, vast periods of time, where people were in the Arctic Circle during the ice ages and didn't have access to any carbohydrates. And I've looked into the whole glycogen in muscles idea. There's not much. There's really not that much, and it goes away very quickly after the animal dies. It breaks down, and so you're not getting all that much in there, and so we wouldn't have had that sort of bonus from carbohydrates in all these different regions. So if insulin resistance or suppression was a thing, then that would be something that we should have seen and probably bred out. And those guys would have died out, the ones that were susceptible to that. But also, you should see an actual suppression, meaning that when you eat protein, you shouldn't actually get a physiological response via insulin. And so you do sort of a modified, a glucose tolerance test, a protein tolerance test, or a Kraft test where you have protein and you see, is your insulin rising to physiological amounts? I mean, that's sort of how you would have to prove that, I think. But what are your thoughts on that? And is there an actual working definition, or is this sort of just like a boogeyman like hormesis?
It was a theory where
Yeah.
someone's looked at a reference range and thought it's really low
Hmm.
and said, oh, it must be suppressed. Firstly a ridiculous um, assertion, because you're not looking at the reference ranges. And I think it's been linked to, like I say, the unreliable HbA1c, where the HbA1c's gone up, or maybe the blood glucose circulating's gone up slightly. It's not really understanding, as I say, that we have 14 GLUT transporters, of which only one is insulin dependent, and it's not totally insulin independent either. So I don't think it's understanding how we get glucose into the cells. So when they see the low level, I mean, we'll use yourself or Sean as an example, or myself. if I was insulin suppressed, I wouldn't have muscle mass. I
Mm.
mean, it's really that simple. That's one of the things that um, insulin does. So well, really, actually, it's an anti-catabolic effect of insulin. We know it's anabolic, but let's look at it the other way. If you have, low levels of insulin, your body would be eating itself. If it was inappropriate, if it was suppressed, you would have muscle breakdown, because insulin prevents muscle breakdown. So I've got very low insulin. I'm not losing muscle. In fact, I'm gaining it. So I
Mhm.
can't have a suppressed level of insulin, even though it's allegedly low. You can't, Anthony, because look at you. You're pretty
Mhm.
jacked at the moment. I don't think you've gone to the gym much. All right. So insulin's protecting you from losing the muscle that you got. Sean Baker's be another one. So if we look at the function of insulin, then we can decide, is it suppressed? Is it low? Is it problematic? Well, that's a big one for me. Like I say, you look at, Richard Smith, very low insulin. Then you look at, say, electrolyte balance. It regulates sodium, for instance. So we all know carb face. Most people have seen the memes, or carb face, low carb face, and it's, there's no water retention. It's not all puffy. I don't think I've got a puffy face. Don't think you've got a puffy face. So I think our sodium balance is good. Our electrolyte balance is good. So we've got appropriate levels of insulin. And I'm going back to this theory is being postulated by people that don't have this symptomology. They don't have muscle breakdown. They don't have puffy faces. That it, you can tell I'm really struggling to actually see any validity in it whatsoever, because they're looking at numbers, and that's not the story. It's an anabolic hormone. If you've got your muscle mass, if you've got your water retention, your electrolyte balance right, if you're still able to build some muscle, actually, and I think, Sean's looking more and more wicked as we go along.
Mhm.
Um, so I think there's too many things that insulin does that we're doing okay for low levels of insulin to be a problem, or for it to be suppressed. I don't know what the mechanism is. Certainly don't understand why eating carbs again would be the thing to do. The only reason that would be is to push that insulin response up, and gaming again. It's just gaming numbers. So
Yeah.
yeah, there is nothing to it. I think
Mhm.
um, I can't see any reason
Yeah.
why we're worried about it. To be honest.
Yeah, well, I mean, and that's the thing too. I mean, you raise a very valid point about the muscle wasting, and true insulin suppression. I mean, its an extreme form is type 1 diabetes, isn't it?
Type 1 diabetes,
Yeah,
exactly. Yeah.
yeah. You've suppressed your beta islet cells in your pancreas from making appropriate amounts of insulin, and you cannot store body fat or muscle, and you waste away, and you get very very skinny,
Hmm.
and
And
well,
you die eventually
you
without
do die
insulin.
eventually, yeah. And
Yeah.
fun fact, the only treatment we had for insulin suppression it was ketogenic diets. I have
Yes.
since the late 1700s to until 1921 when they
Mm.
synthesized or isolated insulin. But I have Sir William Osler's medical textbook from 1910, or the edition was the 1910 edition. He was the first professor of medicine at Johns Hopkins, and he was knighted for his efforts in medical education. A very brilliant man, and just his medical innovations, Osler's nose. There's a lot of things named after him. And he in that chapter he has a chapter on diabetes, and the treatment for diabetes, the one and only for type 1, type 2, they didn't differentiate, was a low to zero carb diet with basically equal parts protein and fat. And basically, you're doing this
Mm.
from meat. It's called animal-based diet. You just ate meat, equal portions fat and protein, cut out the carbs. And that was the only thing that kept people alive with true insulin suppression. And so these people actually were type 1 diabetics and were not able to make insulin, and yet they were living 9 months to a year pretty regularly. He said there's a high mortality rate, but you could extend their life, 9, 10, 12 months, and that not all of them died. People actually lived with insulin suppression. So you actually essentially even reverse that insulin suppression. I've had two patients now. This is actually in the case literature. There are two case reports showing this as well, that people have actually reversed type 1 diabetes by going on to a ketogenic carnivore diet. And what I think is because it affects autoimmune issues, so at a root cause level, I believe that if you haven't destroyed those beta islet cells completely, where they're just not able to make insulin, their insulin is suppressed, but they're not completely destroyed, that you stop that damage and maybe they can regrow. Also, the antibodies only damage the beta cells; they don't damage the beta stem cells, and that's really important too. So if you can stimulate those beta stem cells to make more, and you stop the damage from killing all those new cells, well, then you can potentially regrow those beta cells. And I've had two patients actually follow that, and they went ketogenic carnivore straight away after their diagnosis. And this was barn door type 1. They had antibodies present, they had zero insulin, zero C peptide. They were in DKA, they had polydipsia, polyuria, massive weight loss in a
Mhm.
short period of time. It was just classic.
Mm.
And they came to me, a week or two after they got out of the hospital, started them on ketogenic carnivore, started following them. Instantly, their blood sugar became much more regulated, using much more regular amounts of insulin. And but then after 6 weeks, their C peptide actually was present. It was below the reference range, but it existed. And they were using less and less insulin. They were less insulin suppressed. And then 6 weeks after that, so 3 months after we started them on the plan, they had high normal C peptide, which is a marker of your natural body's ability to produce insulin, called the
Insulin.
endogenous
Yep.
insulin production. And so they had high normal C peptide, dead normal, optimal, dare say, insulin levels, and taking no outside insulin. And so in real terms, they had reversed their type 1. Now, is that going to persist? Who knows? But right now, that's what's going on. One of those people were not able to stay on the diet because they worked in the mine sites and had to fly away and couldn't control their meals. And so they came off of it instantly. Their body demanded insulin, and their blood sugars were all over the place, and they're having a hard time with it. And after a couple of months of this, they said, "No, I have to figure this out." And they started bringing food in and all the rest. And about 3 months later, again, he was able to normalize his C peptide and endogenous insulin production, and he was off all his insulin. His HbA1c was 4.5, right? So people saying that no, 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 we'll still have to have insulin because he won't be able to get proper glucose control. Sorry, his glucose is better than yours, and he has a continuous glucose monitor. There's no variation, just dead flat the whole time. Very
Mm.
low levels and constantly. So to me, that's real insulin suppression, and ketogenic diets and carnivore diets actually treat that.
Yeah, and it's a good way of flipping it. I mean, just
Mhm.
for people who are not sure what you're talking about, the C peptide, the C stands for connected, because in the vesicle, it's connected to insulin. And as it comes out of the vesicle, off goes insulin. But it has a very rapid half-life in the blood. So it's difficult to measure compared to C peptide. So it's a great proxy marker for insulin production. And I mean, one of the things, by the way, but when I was doing my personal training, I used to take this book out, which is
Oh
Medical
wow.
Physiology. And well, the reason is I used to say, look, you can book me for lots of sessions if you want to lose weight, or you can read this chapter on, or even just these highlighted bits
Hmm.
about insulin and how low insulin is excellent, and
Hmm.
increased metabolic use of fat is caused by insulin lack. You know, it
Hmm.
actually says that. So it's known the effects of insulin on fat storage and synthesis. This book, the entire book, is all about the physiology of the human body. But when it gets into insulin, the only thing it wants you to do is
Hmm.
have low levels, appropriate low levels. Um, so I think it's a theory that doesn't even pass the scratch test. You know, as soon as you start looking at it, like I say, adding carbs back in is problematic. Trying to manipulate the insulin number when it's inappropriate. I've seen influencers say, "Yeah, look at this guy; he looks great, but his insulin's really low."
Hmm.
Oh, I think, well, of course, look at him; he looks really great. He's got muscle mass and low body fat. That sounds pretty good to me. I think his insulin is at the sweet spot. I
Hmm.
think personally, I don't think it's low just because it doesn't fit the reference range. I mean, going back to your thyroid thing, I spoke to Amber O'Hearn about this, and I had a guy that was meticulous with his thyroid numbers. Normally, when we talk thyroid, it is females, but this was a guy, and he had 4 years, and he had his TSH, T4, T3, and also, how he looked and felt. It was really important. And he came to me because he said, 4 years they've been telling me I've got subclinical TSH. And I'm just so fed up with this because I feel great. I'm like,
Mhm.
right, okay. But for 4 years, he's been nagged. So we looked at his numbers. And this is what I said to him. And I told Amber about this. She thought it was great. She said, yeah, that's a good thought experiment. I said, look, let's imagine you're the first person that's ever come in with labs. All right. You're the first person that's ever done that. Okay. And we looked at your TSH, which you're saying is subclinical, but I'm looking at these numbers and I'm thinking, well, what does TSH do? It makes your thyroid, because it's not a thyroid hormone, it's a pituitary gland hormone. It tells your thyroid to produce T4 and a little bit of T3. All right. And also, it does have feedback from the body to tell you what's going on. So this perfect set of data. I said for year one, you have a very low level of TSH, which is allegedly subclinical, but your T4 and T3 and your clinical outcomes are great. Then it's the same low number, and the T4 and T3 is about the same, and you still feel great. Blah blah blah. 4 years, right? First time I've ever seen bloods. I'm going to work out reference ranges. That's perfect TSH
Mhm.
because it's got everything. It's got the level, it's about the same, and the outcomes and the clinical outcomes. So we've got the numbers and we've got the real life experience. And that said it all to me. It's not about the numbers because this guy was living proof, sadly, didn't want to do an interview, but it
Mhm.
it was amazing because it was there in black and white that the body is smart. We are so arrogant to think it's always going wrong and we can tweak it and can biohack it. When we take like cofactors, I'm going to take this amino acid and this amino acid, and it's going to make this in my body. No, your body won't necessarily do that. It will
Mhm.
do what it thinks. I'm not a great fan of all the cofactors and stuff like that because the body does what it wants to do and what it thinks is best. And you can't force it to make glutathione, or you can't make it do
Mhm.
what it doesn't want to do. If you're short of nutrients, then it makes sense. If you're not eating foods that got B1 in or B9 or B12 or whatever, you're going to have a problem. I'm not saying that, but I think if you are eating this way, you are getting those things. You're getting all the B vitamins. You're getting enough folate. You're getting everything that you need, all the essential amino acids, all the essential fatty acids. Let it just do it. And don't worry about numbers. If your outcome is great, that's fantastic. Now, if you're transitioning, say, you're new to this way of eating and you're having trouble with fat malabsorption, I'm not used to the fat. It makes, I can't cope with it. Well, there's two things you can do. One is you can have smaller meals with a bit more frequency, give your body some chance to do it. Or you could go over your body's physiological limits and have like ox bile.
Mhm.
I don't like doing that either
Mhm.
because you're taking something that you're producing bile, which isn't up to speed yet, and you're saying, "Here's my little bridge." So I think I'm not anti people trying to get around these things and do workarounds and stuff like that. But in the end, and I'm going to steal this from Ben Azadi, vitamin P is really good. That's patience.
Mhm.
Just let your body work it out. You transition slowly, I think, and your body will work all of these things out. It will give you the appropriate level of insulin. It will give you the appropriate level of growth. It will give you the appropriate level of thyroid hormone.
Mhm.
And your body is so good at regenerating and healing. It might take a year, might take 6 months. But I will go into one little proviso. But that being said, it also does depend on your personality. If you're a personality that can't moderate and you have to abstain, so I'll have someone, I used to smoke like 5 packs of cigarettes a day and I just gave up like that. Well, that tells me that person you need to stop doing that and you need to start doing this. But then you just tell them there's going to be a whole host of toilet issues for 3 or 4 weeks and
Mhm.
you might feel worse before you feel better. But don't just go by numbers. Don't think that listen to an influencer and yeah, my insulin's going to be suppressed. No, your
Mhm.
insulin is going to be adequate for the carbohydrate intake and even the you know endogenous production of glucose, which still needs insulin. So don't worry about it.
Yeah. Yeah, well, I mean, that's always what I try to, tell people. Try to do something now that you can continue doing 40 years from now. That's going to still work for you
Mm.
now, 40 years from now. Eat fatty meat till it stops tasting good. Do that as many times a day as your body's telling you to, and live your
Yeah,
life, exercise, get outside, do those sorts of things. And you can do that when you're losing weight, trying to put on muscle, trying to just maintain where you are, because your body will tell you sort of how much to eat. And if you're sort of gaming the system and doing things and adjusting things in such ways to get faster, fat loss or something like that, then I mean, sure, you could probably do that, but that's not necessarily. But then what do you do after that? I mean, it's not something that you can do forever. And so then you have to go back to doing this, and then is there going to be some rebounding effect where you sort of trash your metabolism, and then you sort of put back on some fat or something like that, or it's just you're just not as healthy as you would be, and you don't have the practice and the habit of eating this certain way that you can just sort of continue this forever, which is, I think, the best way to do it. And you mentioned before with the subclinical TSH. I mean, if
Mm.
your T4 and T3 are optimal and you're feeling great, I mean that's fantastic,
Yeah,
right?
yeah.
Because
That's my point.
yeah, well, I mean, that's what I tell people. TSH is basically a marker of how hard your body has to work to make the amount of thyroid
Yes.
hormone that you're producing. And so if
But
that's
you could,
low,
sorry, Anthony, can I
hmm,
just pick up on that? But you could theoretically, say that's TSH suppression. That was the point I
yeah,
was making. Yeah.
yeah, exactly.
Sorry.
And so, yeah, you could say maybe there's a pituitary issue and that your pituitary is not able to produce appropriate amounts of TSH, or maybe, pan
Mm.
hypopituitarism, you have all these different hormones. But that would only be the case if you were subclinical on T4 and T3, right? But if you
Yes,
have
exactly.
optimal levels, right, then your body's just not having to work hard. Same thing with
Yeah.
insulin. If you're not having to work very hard um, to get the physiological effects that you need, you only need a certain amount of insulin. Well, then that's fine, even if it's sort of subclinical. And the other thing is that insulin suppression, if it were suppressed, what would be the first thing you'd see? High blood sugar, wouldn't you?
Yeah. Yeah.
Right? And yet we're not
Yes.
seeing that. And now, if someone were now,
But that's
type
the
one
reverse
diet,
engineering bit, isn't it? That's the
yeah,
bit. They're
yeah,
looking at the HbA1c and not realizing that's unreliable. Oh,
right. There's
that's
that
gone up.
too.
So it must be insulin suppression because that's gone up.
Hmm.
What you just said. Well, they're putting the cart before the horse and using the
Yeah.
wrong metric.
Hmm.
That's it's like
Well,
saying, look at TSH because look at what it's doing to your cortisol. Like, well, hang on a minute, you've really gone off piste here.
yeah,
You these like you just say, if you're insulin suppressed, your blood glucose goes up. Well, yeah, but
yeah,
that's not happening. But
yeah.
secondly, the theory is saying you're insulin suppressed, your HbA1c's gone up. No, your red
Hmm.
blood cells are living longer. You're not factoring in that thing.
Yeah.
That's, sorry, I'm frustrated about this
Well,
whole thing. It's a
yeah. Well,
ridiculous thing, isn't it?
the thing is, and we have a craft test, right? So, I mean, that's
Yes.
what you'd want to do, right? You give
Mm.
somebody, some glucose, sugar, whatever, and then you check their blood sugar and their insulin, and then a couple hours later you check their blood sugar and their insulin, and then 5 hours, and, blood sugar and insulin, and you see what the blood
Mm.
sugar is and what the insulin response is, and is there an appropriate drop in your blood sugar, is appropriate rise in your insulin, is there appropriate drop in your blood sugar, etc. And so if you saw that after 5 hours your insulin had barely come up and your blood sugar had stayed elevated, well, I agree, you're not making enough insulin, aren't you?
It's
Right?
so simple, isn't it? Yeah.
Yeah. And but that is what you would see. And you know what, you do see that like actual I would say, insulin insufficiency, where someone can be a type 1 or type 2 diabetic for several years or decades, and they're running at such high insulin levels for so long that they actually start
Mm.
burning out their beta islet cells. And so
Yep.
you do see patients sometimes, I'm sure you've seen many of these, where they
Yep.
actually do have lower insulin levels, but their blood sugar is very elevated, and
Mm.
their HbA1c is actually appropriately elevated. They're at 9,
Mm.
10, something like that, 11,
Yeah.
but their insulin is just not cutting the mustard. But again, the treatment for that is put them on a ketogenic diet, and that sort of reverses
Yes.
that diabetes. And the Harvard study showed that 100% of diabetics, that were on injectable medications like injectable diabetes medications like insulin, 100% of them came off 100% of their injectable medications, right?
Yeah,
Which is pretty significant as well, I think.
it is rather. It could
Yeah.
get any better, could it?
And the other thing with insulin suppression, just not to beat a dead horse, but the one thing that sort of confused me about that is why is this being suppressed for protein and not carbs? Right. I mean,
Mm.
the answer to this was to add in, fair enough, low amounts of carbohydrates. And they're not telling you to, dump in, 200, 400 grams of carbs, like some people say, but add in carbs and to stimulate that insulin. Okay, well, why is it suppressed for protein and not carbohydrates? Why is carbohydrate and how does that reverse the suppression? What is suppressing the insulin? Why is it suppressed for protein and not carbohydrates? Or is it that you just get such a massive spike from carbohydrates that it's forcing the suppressed amounts of insulin to get up to where you want it to
Mm.
be? And then how does eating carbohydrates then reverse that suppression? You know what I mean? I mean, there's no
Yes,
mechanism
I know exactly what you mean. I know
that makes
exactly what you
sense.
mean.
Yeah.
It's a bit like, what they're saying is, can we have an inappropriately higher level? Because your insulin is being released at an appropriate level. That's what's happening. Exactly
Mhm.
what you just said. There's no carbohydrates, there's protein and fats. That's the amount of insulin we need. Just look at
Mhm.
our clinical outcomes. It's a bit like, when you go to the gym and you look at some weights, and it might be some influencers' weights that have got a
Mhm.
certain number written on, but they're actually much, much lighter,
Mhm.
right? If you went to pick it up, you pick it up like you were trying to throw it because your body had prepared for a much heavier weight.
Mhm.
You would be inappropriate. So what you're doing is you're doing an inappropriate release of your energy because you're expecting more, right? So what you're doing with this insulin suppression theory is saying, well, you only need this amount, but I think it's low. So let's artificially have more insulin than we actually need.
Mhm.
you know, which is crazy because all you're doing is you're saying, right, here's your glucose concentration, here's your muscle, here's your homeostatic sort of where you are at, your body fat is where it is. What we're going to do, we're going to put some carbs in, and that will raise your insulin. Well, actually, it's complete. The net effect is completely negated because you put the carbs in, and the insulin raises to work on those carbs and brings it back down. Once you
Mhm.
stop eating the carbs, it'll be back where it was
Mhm.
because insulin is responsive to the biochemistry that's going on and it's like to biophysics. So it's pointless. It's a pointless exercise. Exactly what you just say, because it's the pancreas isn't going to go, woohoo, we're making so much more insulin. Whatever happens, guys, let's keep it up. It's not going to
Mhm.
do that because the body is so smart. It doesn't waste substrate, doesn't waste energy. And like you say, true insulin suppression is type 1 diabetes where you can't make enough.
Mhm.
It is a name that's been added to something that is just a physiological response. We live in a lower insulin environment. It doesn't matter about the reference ranges. The HbA1c is misleading for people. And also, you know, the what should our blood glucose be? Well, people think it should be under 100. Nice arbitrary number, isn't it? It fits really well,
Mhm.
unless you're in the UK where it's millimoles and completely different.
Mhm.
Um, but who says? Why can't it be 110? Why can't 110 be okay? Well, maybe in a low insulin environment with optimal health, it's probably all right. It's probably quite good. I mean, I would only worry to be frank, and we know this from clinical experimentation that 100, I'm not saying to get to 179, for instance, but 180 milligrams per deciliter is roughly where the excess glucose starts going into your urine, which is, the classic symptoms of what actually diabetes mellitus is, which is a combination of Greek and Latin, which just means passing through honey tasting piss, basically. Sorry to swear, but that's what it means.
Mhm.
Um, so maybe we should go back to the fact that that's how they used to diagnose diabetes. Have you got sugar in your
True.
urine, and are you're not looking healthy? Because the numbers are misleading people. They are definitely misleading people. Don't worry, and also maybe look at the context. You've got 5 liters of blood, and I use this to get across what concentration of blood glucose means. So you've probably got about 5 litres of blood, all right? And then
Mhm.
you've got a kid next to you who's 10. They've got 3 litres of blood, and you've got 2 cans of Coke. Both have got 9 teaspoons of sugar in, right? So I take it, wow, 9 teaspoons in 5 litres. Why is that kid hyperactive? Because it's 3 litres with 9 teaspoons.
Mhm.
So the concentration from this one inoffensive can of Coke is really bad for that child. So maybe the concentration of glucose is is okay at 110, because we're not talking 9 teaspoons. We're talking from 100 to 110. We're talking 1 teaspoon of sugar in 5 litres to 1/10 of a teaspoon in 5 litres extra. It's not a lot. I
Mhm.
personally wouldn't worry. And if the American look spoke in millimoles, you know, it doesn't sound so different. 5.5 to 5.6, not much, is it?
Mhm.
But 100 to 110 sounds worse. But I think if you did a sort of lab experiment where you put 5 litres of fluid somewhere and you had a pipette and you dropped in 5 grams, and you said, "Oh wow, look, you're worried about this," and you squeezed a 10% of the pipette in there,
Mhm.
people would go, "No, it's not really that much, is it?"
Mhm.
So I think it's just sort of trying to get the frame of reference right.
Yeah.
So I think that's one of the things. I mean, I know it's not the greatest analogy and it may be a bit patronizing, but you know, it's also over time, isn't it? So
Mhm.
if you kept it at 100, say, for 24 hours, and the next 24 hours, the next 24 hours, there probably wouldn't be much difference between that and maybe 110 over hours and hours and hours and days and days and days. I don't think there would be much difference. I think the body will probably cope with that okay, especially if you're fat adapted. Um, but it it's it's beyond me why it's got any traction, because it just doesn't make any sense to me. Just
Mhm.
doesn't does
No.
not do anything for me whatsoever. But there are so many myths with this way of eating. Like iron overload, and
Mhm.
that's another one that keeps coming up. And people don't get the right panels, and they don't look at the right things. They
Well,
just read,
yeah.
"Oh, I've got red meat,"
Yeah.
and there's loads of iron in that. It's going to be a problem, isn't it?
Mhm. I
Why?
Yeah, well, and like to your point, I mean, I have patients with genetic hemochromatosis with the phenotypical sort of presentation where they have iron overload, actual depositions in their organs. They have to get regular blood draws, and then I have people that don't have the genetics, but phenotypically they still get overload, and they have to get every 2 months or so they have to get their blood drawn. And when I put them on carnivore diets, eating just red meat with all the most bioavailable versions of iron, which is heme iron, actually their ferritin levels come down and normalize, and they stop actually depositing. Actually reverses this iron overload, and so yeah, there's a lot of these things, and what I explain to people is that it's not about how much iron you're getting in your diet. It's about how your body processes that iron, utilizes that iron, metabolizes that iron. Because in hemochromatosis, you're just not letting go of it, and you're depositing it in places it's not supposed to go. So there's physiological dysfunction there. It's not because you're just eating too much. I mean, if you're massively supplementing or something like that, I'm sure you can cause problems, but not from our physiological diet, just from a normal amount in our diet. And to it reminded me of something when we were talking about HbA1c, was that athletes can typically make higher blood sugar. They actually, while exercising, it's very normal for athletes who
Yes.
wear CGMs to see that blood sugar level go up. And if you're like someone like Dr. Baker, who has said he wears a CGM, and when he's doing a really hard workout, just going crazy on deadlifts or rowing or whatever, he can actually see that go up to 200 on
Mm,
his blood sugar. And so, but that's physiological. That's what his body
mm,
is doing. So if someone is working out a lot, especially if they're working out every day and they're getting their blood sugar levels physiologically coming up, that could also alter the HbA1c. So it might be that in passive sedentary populations that are on ketogenic carnivore diets, you may not see any issues with HbA1c. But I've eaten the exact same thing for basically a decade, and my HbA1c will actually still fluctuate to this day.
Mm.
And so it was like, okay, well, why the hell is that? Okay, well, maybe some stress, maybe some sleep issues or whatever, and jacking up cortisol or whatever. But it could also very well be something to do with exercise. And during periods of time where I'm more active in lifting weights or playing rugby, could very well be higher levels of HbA1c. And thinking back on that during those periods when I was lifting weights basically 4 or 5 days a week, playing rugby 3 or 4 days a weekend. That was when my HbA1c was higher than other times. It was never high, but it was higher than other times. And then other times when I hadn't been able to work out and exercise and been more sedentary, it had just sort of just come down. Don't know, but
Yeah. Well,
there's that too.
there's so much to the variation. It's unlikely it's going to be dietary, to be honest, and
Yeah.
also red blood cell lifespan is going to affect that, and enzymatic reactions and damage. So, for instance, when you do physical activity, yes, you will get more glucose going into the cells, and there'll definitely be more blood pumping around. But you also get more damage as well.
Mhm.
So that you may have actually been at some point where your body was coping and there was less damage. So the red blood cells, they secrete a substance phosphatidylcholine, which is from their membrane, which says to the spleen, we're broken. You need to eat us up. So it could be a day old. I mean, it really could be.
Mhm.
And that's going to mess your figures up. So if, for instance, if you had a side injury, someone runs into you in rugby, you're going to get damage, but you're going to get damage to red blood cells as well as every other sort of thing. And this is where, Kevin Stock done an excellent article about AST and ALT, the liver enzymes, for
Mhm.
instance, and how they can be elevated. Another example here, actually, Anthony, of, you know, as soon as you understand let's get it really basic, right? If you run and your legs are worn out, you'll make more enzymes to repair your legs. Right, simple as that.
Mhm.
So if we had a blood marker was leg enzymes, oh, it's up. Well, you were a runner. Yeah, right. Fair enough. That was it. I mean, it'd be that simple. So when we look at ALT, alanine transformase, which basically is repair is protein synthesis. So if you've got broken muscle fibers, which is partly what happens when you exercise, here's an enzyme that's critical in producing pyruvate and glutamate from other substances which they swap around. So that's what the enzyme does, moves the amino group across, which is where the name comes from. Well, once you know that that's what it's doing, it's making more muscle cells, or it's involved in protein synthesis. Makes total sense that it's going to be elevated if you do intensive workouts.
Mhm.
Simple. So, you know, we can glibly say, oh, your ALT is a bit elevated. Do you work out? Yeah, I work out. Oh, that's probably all right. But it's nice to know if someone says, what does that mean? But as soon as that's why I like the leg analogy. As soon as you say, that's basically what happens. Enzymes make stuff and you've broken loads of stuff, right? So you need to rebuild it. And it's the same. So HbA1c is a marker more of red blood cell viability and lifespan and health, to be honest. If my HbA1c went right through the roof, but my C-peptide, my fasting insulin, my fasted glucose was fantastic, or I wore a CGM and I had, like you say, the flat line, wonderful management, I'd be like, wow, my red blood cells are superhuman. Look at
Mhm.
that. So you could completely flip what the usage is and say this is great for your red blood cell life. Because if you get into I know you could take one thing out of everybody and, you'd die if you didn't have enough this, enough that. But if you take red blood cells out of how you live, within seconds, you'd be gone because it delivers oxygen, it delivers iron. And a big thing it does, of course, is like gases exchange. So it takes your oxygen around. Many people miss the fact that when the blood returns to the heart, everyone says deoxygenated. No, it's saturated with carbon dioxide nutrients. So that the portal vein, portal meaning door, is the door to your liver, coming from every single organ, full of nutrients, absolutely huge amount of blood every minute, over a litre of blood, full of nutrients, full of carbon dioxide and stuff like that. Well, that's the red blood cells. That's what they're
Mhm.
doing, guys. They're doing everything. And we need to keep them healthy. We need to make sure that we're not glycating them and we're not damaging the lipid portion of the membrane. And adding carbohydrates will not do that. It will definitely make it will be deleterious to them. Simple as that. Because I'm going to go back to that point. You are glycating and deranging proteins in an irreversible fashion once you put glucose into your system. Even if the superhero insulin is in abundance, you're not going to stop that level of glycation. That's going to go up. So when someone says, 15 grams of carbs, that's not going to hurt. Yeah, it
Mhm.
is. So if you look at someone like Paul Saladino, I hate to name names. I love him, right? I really do. But I do think he's aged. I do think he's aged in a faster way since he's been having a lot of carbohydrates. Well, that will be because of things like collagen being deranged and the cross links being made. And that is what aging is, that these things, these structures permanently fixed together, and your skin looks a bit older than it should. So that also explains this way of eating, why people feel, well, you don't really look your age, or you're reverse aging. That's a phrase we hear in carnivore ever such a lot. And that's
Mhm.
because we're keeping the carbs out of our system, which the mechanism, we're stopping the glycation. We're stopping all of that irreversible protein damage happening. And at the red blood cell point of things, therefore your delivery in three ways. So albumin is not being deranged, it's not being glycated. So the delivery of everything, 60% of the protein in our blood is albumin. That's not being deranged. The red blood cells, like I say, talk about iron just then, 90% of the iron you've got in your body right now is coming from recycled hemoglobin. So the recycling of red blood cells is really critical as well. And the production of heme, which is absolutely at the first stage of heme production, ruined by glucose.
Yeah.
It affects the ALA enzyme. So all of this stuff is biochemistry that you can look up. It's all factual. So heme is like a fantastic protein, and myoglobin. So hemoglobin is, like a cage really, where it has four ions in there, and that obviously carries oxygen. Myoglobin, which is in the muscle, that is like a cage, but it only has one ion in it, so a little bit of oxygen for your muscle. Well, if you make the production of that not so good, if you make that the heme part smaller because you're restricting the enzyme at the beginning of the stage one, then everything else, every knock-on effect is there. Your iron and your oxygen supply. So when you got the guy with the hemochromatosis, then I think we should talk about maybe copper as well, because that's underestimated.
Mhm.
What you've done is you've improved the delivery right at a sort of atomic level of iron and oxygen, because you're giving him a diet that's improved the health of the red blood cell, which is the delivery method of iron and oxygen. So you've said to this guy, right, you have got an iron problem, genetic, but also you've made it worse because the environment around that genetic problem is is making it, it's sort of running against the wind, swimming upstream against the current. Well, what we've done is we've turned that all around. So yeah, you have that thing. You're not a great swimmer, but now the current is pushing you, is behind you. We've moved that all around. I'm not very great with off the cuff analogies, but that's what you've done. You've got to the nub of it. The iron delivery and the oxygen delivery, the heme itself, the very structure that does all the work, is improved with this way of eating. And we can prove that. We know how heme is made. We know how red blood cells are made. And I think they're the key to everything, which is why, I think I missed my calling when I did the phlebotomy. I should have gone into sort of more advanced hematology, because it's absolutely fascinating. But when you understand that, iron isn't just about you eat some red meat, it's got some heme iron and it's going to overload you, which is the most ridiculous thing in the world. And that's the other thing. You get people with, they're well-meaning. Oh, now I'm eating red meat. I've gone to my naturopath and they said I've got to take tons of vitamin C. And I'm like, well, why? Well, because of iron. I'm like, yeah, but that's non-heme iron from plants you need vitamin C for. You don't need it for non-heme. There's no conversion from non-heme to heme. And it's, for those that don't know, you need vitamin C ferroreductase. It reducts the heme from Fe3 down to Fe2 plus. And you need vitamin C for that. So you need a lot less vitamin C. So all the advice is well-meaning, but it's not got the biochemistry or the background to actually justify why they're doing it. So vitamin C in that instance would have actually been detrimental. because we don't need that much vitamin C. Ascorbic acid can actually have a problem in the cell when we're talking about, iron absorption. And, an often missed part of the jigsaw is copper, because when Fe2 plus comes out of the cell and it needs to go back to Fe3, you need an enzyme called hephaestin, which is named after Hephaestus, I think the Greek god of iron and fire. Now, this enzyme is copper dependent. So if you haven't got enough copper, that Fe2 doesn't become Fe3, doesn't get transported, and it becomes Fe2 in the bloodstream, and you get reactive oxygen species. You've also got ceruloplasma also going around, which is, again, that's copper related, and that takes the Fe3 around the body, and also has that enzymatic reaction where it would take Fe2 and knock it down to put it back up to Fe3 to be able to transport around in the bloodstream. So I think there's so many little nuances. Everyone talks about copper toxicity, iron overload. Well, actually, it's probably copper deficiency that is causing you to have any iron problems. But the end result you got with the guy with hemochromatosis is, I think you've ticked all those boxes. There is copper in meat, and in the carnivore diet, there's plenty where it's pretty much devoid in plants, because it's as with the story of all plants. If there is any copper, it's all locked up because the plant wants it.
Yeah,
that's why it's there. So
yeah.
Sorry, I did a bit of a Richard there. Went off on a tangent there.
That's like we all do. That's fine. No, that was great, man. Thank you so much for that. And well, look, that was really, really educational. Absolutely great to get a deep dive in all these things. And I think they're all very, very topical things that are affecting everybody now, because, like you said, there's a lot of myths that are going around. And but if you just look at the people that have just been doing this consistently, like you and I and all the people that have been doing this 20, 30 years, the Inuit who have never not done this, or never, hadn't done anything different previously. This is just, you just eat fatty meat until it stops tasting good. And don't eat other things. You don't need other things. You don't need to game the system. You don't need to game your numbers. Lions don't check their bloods, and neither do Inuit. Certainly if you have a health condition, then yeah, you might need to track that. Or if you're from a deficient state and you're trying to catch up on your vitamins and minerals and certain metabolic issues or whatever, then there might be something to that. But, generally, if you're just eating what you're supposed to eat, your blood work should look the way it's supposed to work. And so I wouldn't get too caught up on that. And so it's important. I think that's good that we sort of did that deep dive into that, and hopefully put some people's mind at rest. Stephen, thank you so much. Can you tell us, any parting thoughts, and also just where people can find you and follow you and see more of your stuff?
Final thoughts. Well, firstly, I want to thank you, Anthony, because it's always great to speak to you. You're a very generous person. For people that don't know Anthony, other than what you see on the screen, behind the scenes, he's just as nice and pleasant and hardworking and everything. So yeah, I could cry almost, because it's really nice to meet a genuine person. No, it is. It is. I mean that from my heart.
Thank you.
Yeah, I've really felt for you in the last few months, and you've been greatly missed. Right. And you're a big supporter. All good. Right. Enough of that. Yeah, if you want to contact me, my Substack is the ukcarnivore.substack.com. If you want the science. Anthony thought that was a deep dive. It really wasn't. It was really superficial. But I'm a great believer in demystifying everything. So I try to get words and tell you what they mean, so you can start making your own connections. I do a weekly thing. So it's every day, but every week I get some bloods and interpret what it's saying and why it says that, and why that might be important or not important. So that would be the first place to go if you want a written article. If you want to go online, I've got a YouTube channel, which you can just type in youtube.com at Coach Stephen. You can also look at Stephen Thomas BSc Honours. So yeah, YouTube's pretty good. The school community I host with Richard is excellent, Low Carb School. Or if you want to do a live question and answer, if something's tweaked your interest and you think, oh, I'd like to question that, or that doesn't make any sense, or the guy's talking out of his rear end, I want to have an argument, then every Sunday at 7 p.m. here in state-controlled Britain, we do a live question and answer where you can come along and ask me or Richard what you think, and that's completely free. So make sure you come to the channel and subscribe and all that sort of stuff. Make sure you do that for Richard as well.
Perfect. We'll put those links in the description, and everybody can go check you out there. And please do follow Stephen, his Substack, and all his channels because there's a lot of great information there. And yeah, well, thank you very much, Stephen. It's been a pleasure as always. Really good to see you, and thank you so much for taking so much time with all of us.
Okay. Thanks, Anthony.
Thank you. And thank you everyone for joining. Hopefully you enjoyed that. And if you did, please do like, comment, and share with anybody you think would find that valuable. Thank you all very much, and we'll see you next time. Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.